Attention Deficit Hyperactivity Disorder, known as ADHD, is a condition of the brain that makes it hard for children to control their behavior. It is one of the most common chronic conditions of childhood. And joining me today to talk about it is Dr. Brian Sheridan, who is a pediatrician at the Schoolhouse Road Pediatrics in Guilderland. Thank you so much for joining me today.
No problem. Thank you for having me.
So, Dr. Sheridan, what exactly is ADHD?
Well, ADHD, or Attention Deficit Hyperactivity Disorder, is a disorder basically split up into three parts. The first is children are often inattentive, have trouble focusing or paying attention, whether that's in school or at home, usually both. They can also have hyperactivity symptoms where they're very fidgety or fussy or jumping out of their seat. Or they can have a combined aspect of that where they're both inattentive and hyperactive.
That's often confused with ADD. What's the difference between the two, ADHD and ADD?
Yeah, ADD is kind of an old way of looking at it. We say everybody now has ADHD, and then you have either...
You know, when you're saying everybody, adults and everyone?
Well, we all might have a little ADHD. That's why we take our cup of coffee in the morning. But that caffeine is good for us. But no, it's whenever somebody's diagnosed now with ADHD, they have either the inattentive type, the hyperactive type, or the combined type of ADHD. We used to say people with ADD were more the inattentive, meaning they didn't have that hyperactive part.
Okay.
So.
Do you think teachers, parents, doctors are too quick sometimes? It seems like every child now is diagnosed with ADHD.
I look at that two ways. I think a lot of times teachers, doctors, and parents, we're all partly to blame for why we are too quick in diagnosing it. If you have a 6-year-old child who's in kindergarten and really the structure of learning for him might be different where he is bored, maybe he's too smart, needs to be accelerated a little bit. He could be a little bit anxious about being in school, it's his first time, so a lot of times parents or teachers or doctors even might say, boy, let's just give him some medicine to calm him down a little bit.
Vegetable, like,
yes.
Don't bother me,
yes.
right?
So there's definitely an element of that. Then there's the other way where parents are hesitant to formally diagnose a child because we don't want that child to be labeled with something, and that's a big thing and something that we have to respect in the medical community.
Like, what's the best way to deal with something like that? How do you know if it's one extreme or the other?
Right. The first thing is stay in contact with the teacher. You know, talk to the teacher on a regular basis. Schools are doing a great job now where grades are being posted online. Parents can email teachers nowadays, so keep in touch with a teacher on a regular basis. And when they start to see problems, or you start to see problems, or usually family members start to see problems with hyperactivity or inattentiveness, come to the pediatrician and sit down and talk to them and present those symptoms to the doctor and let them work it out with you so that we can try to come up with a diagnosis.
Are there other symptoms?
School time is when it's usually noticed the most, where your kids have expectations. They're expected to sit and pay attention, focus with the teacher for long periods of time, depending upon the age. It's unfair to ask a kindergartner to sit still for 60 minutes.
Especially if it's a boy.
Especially if it's a boy. So that can be hard when your child is doing that. At home, it can be harder to miss because your child has maybe 3 or 4 hours where they can get their homework done, so parents will say, wow, they have a lot of homework. Well, maybe they don't have a lot of homework. They're just fidgeting and squirming and watching TV and paying attention to other things. So inattentiveness can present with taking a long time to do homework, fighting with your child over homework times. It could also be that, I always tell parents, if your child isn't organized, when they come home and you open up their backpack and it's like you're looking into a dark hole, with papers misplaced and homework not being handed in, then that's another sign that you need to think about as well. But you don't want to, like you say, overdiagnose it as well.
And there's medication for that.
There is medication. And when you look at studies for ADHD, we find if your child is properly diagnosed with ADHD, then medicine is actually the right way to go. Children with anxiety, for instance, we know counseling can be more superior at times to medication.
Okay.
Whereas with ADHD, we find counseling can be a benefit, but by far medication is the way to go if it's the proper
Do they
diagnosis.
have to have medication their whole entire lives?
Not necessarily. You'll hear people grow out of ADHD, and there is some truth to that. Although what we're finding is kids with ADHD, a lot of times when they get into college, they learn to cope with using other mechanisms in order to get through without needing medication anymore. But if you're in a position in college or further on where your job requires you to be focused, then medication might be a good thing for you to take chronically. Another point that we always make with teenagers, 16, 17, 18-year-old is you're going to be driving a vehicle now,
Right.
so we want you to pay attention to the red light and the stop sign, and the medication can actually help you do that. So we don't rush to take kids off the medication. We
Gotcha.
like to go slow with that too.
And besides medication counseling, what are some of the things that parents can do at home to work with their children to help them with that?
Trying to get a structured life at home, kind of like you see in school. When a child comes home, don't let them throw their backpack wherever they want, kick their shoes off under the couch and go upstairs and just get undressed and throw their clothes everywhere. I mean, it's a good idea to have them come in, put their backpack in the same place, put their keys in the same place, take their shoes off. And then usually I like to tell parents to start homework early when the child comes home so that they get their homework done first. And getting into a routine like that is important. There's side effects to the medications as well that need to play in this, to that.
And what resources are there available for parents?
So I refer people to is the American Academy of Pediatrics is www.aap.org. And they have a wonderful website for not only ADHD, but lots of things that you might want to know about your child. And they have a good ADHD section as well to say, is this right for my child? Is this the way to go?
All right. Thank you so much for joining me today.
Problem.
Thank you.
Okay, thank you.
And if you would like to know more about ADHD or if you have a question for Dr. Sheridan, just log on to my website, parentologywithpaula.com. Coming up, how to create happy, healthy, pain-free kids. Trainer Brett Klicka has some body weight exercises that you can do with your child without having to leave your home.